In this video, you'll get a quick overview of the Urinary Hormones Test. I'll explain the Vibrant advantage and technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The Urinary Hormone Test is Vibrant's most comprehensive hormone test panel. It measures 67 analytes, including sex steroids like androgens, progesterones, and estrogens, as well as their hormone metabolites. Metabolites are only found in urine testing and can't be measured in serum or saliva. The Urinary Hormones Test also includes glucocorticoid hormones like cortisol and cortisone, as well as melatonin, bisphenol A, and 8-OH-DG. Hormones are essential chemical messengers which regulate routine processes in the body. Both hormone and hormone metabolites can be active and bind to receptors. Measuring both provides a thorough assessment of hormonal activity, as well as overall hormone production and metabolism. The Urinary Hormones Test offers adrenal hormone and melatonin testing at 4 points throughout the day, which aids in assessment of the HPA axis and circadian rhythm, respectively. This makes the Urinary Hormones Test beneficial for patients with circadian rhythm imbalances, insomnia, and patients currently taking melatonin supplementation. Other symptoms of hormonal imbalances that would benefit from urinary hormones testing include hot flashes, night sweats, hair loss, anxiety, depression, low libido, weight gain, poor stamina, and fatigue. Vibrant's Urinary Hormones Test is an easy at-home urine test. Patients collect their first morning urine 2 hours after waking, and then an evening, and finally a night sample. There are no diet or supplement restrictions. However, women using vaginal hormones should avoid doing so for 72 hours prior to collection. For menstruating women, the best day of the cycle to test hormones is during the progesterone peak of the luteal phase, between days 19 through 21 of a 28-day cycle, or about 7 days after ovulation if tracking. For longer cycles, add the number of days beyond 28 days. For example, collect on days 21 through 23 for a 30-day cycle. In a similar manner, subtract for shorter cycles. For example, collect days 17 through 19 for a 26-day cycle. For irregular cycles, collect 5 days before your period begins, and for unpredictable cycles, collect any day when not bleeding. The Urinary Hormones Test also requires your patient to complete a hormone testing questionnaire for more accurate results. The questionnaire must be completed before the sample can be processed, so results cannot be finalized without it. The Vibrant Urinary Hormones Panel uses liquid chromatography tandem mass spectrometry, or LC-MS, for quantitative detection of cortisol, cortisone, and melatonin markers, as well as gas chromatography tandem mass spectrometry, GC-MS, for quantitative detection of the remaining hormone and metabolite analytes in urine samples. These are powerful analytical techniques that combine the separating power of gas or liquid chromatography with highly sensitive and selective mass analysis capability of triple, quadruple mass spectrometry. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and full report. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Urinary Hormone Sample Report includes a cover page, introduction, summary with interpretive comments, graphs, and flowcharts, then lists all 67 hormones and metabolites. The cover page lists the sample type and results interpretation key. The introduction page introduces the methodology and interpretation of report. And I highly recommend reading this page, especially the part of the introduction where it says, quote, "Reference ranges have been established using a cohort of 1,000 apparently healthy individuals," and also the part where it says, "The classification of red indicates a result that is outside the reference range, and the classification of green denotes a result that is within the reference range." The summary shows the markers outside of the reference range, be it too high or too low, along with an interpretive comment. The summary also includes the questionnaire data. The summary also includes several graphs and flowcharts. The upper left shows the brain signals that drive DHEA and cortisol production. That same page includes graphs of your patient's diurnal melatonin, cortisol, and cortisone levels. While all green dots are technically normal, as opposed to red, which are abnormal, you want your patient's values to match the pattern of the light green shaded area. The next page includes the sex hormone flowchart showing how pregnenolone can be made into progesterone or DHEA, and how DHEA can be made into androgens or estrogens. The estrogen section provides additional insight into liver detoxification by quantifying how much 16-OH, 4-OH, and 2-OH estrone your patient is making via the cytochrome 3A4, cytochrome 1B1, and cytochrome 1A1 enzymes, along with a speed dial showing methylation activity. In other words, how well is your patient's COMT enzyme turning their 2-OH-E1 into 2-methoxy-E1? And then the full report lists the levels of all 67 markers, including 8-OH-DG, a marker of oxidative DNA damage from reactive oxygen species, the androgens, including DHEA, testosterone, and DHT, creatinine, melatonin, estrogens, and also note that BPA is included in the estrogens panel. This is because BPA is a known endocrine disruptor. Since humans are ubiquitously exposed to BPA through food packaging, paper receipts, sports equipment, medical and dental supplies, and subsequent contamination in dust, food, and water, BPA monitoring and avoidance is advised for conditions where estrogen excess-related illnesses is a concern. The full report also includes diurnal cortisol, diurnal cortisone, total cortisol and metabolites, and finally, progesterones. The results are reported as both a number and also plotted graphically so you can visually see how high or low your patient's results are. If you want to learn more about the urinary hormones outside of the reference range, simply scroll back to the report summary to read the interpretive comment. You can take an even deeper dive by checking out the Urinary Hormones Interpretive Guide in your provider portal. One last thing to point out is that all urine tests should also measure urine creatinine. This is because urine can have varied concentrations. Sometimes it's a pale yellow, sometimes it's an orangey brown. Good news, urine creatinine is constant. So all urinary hormones levels are normalized to urine creatinine to account for urine dilution variations. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you are sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there is more than one root cause contributing to your symptoms. Tests that pair well with Vibrant's urinary hormones test include the saliva hormones test, which assesses the bioavailability of hormone levels in target tissues. Therefore, patients utilizing topical hormone therapy or presenting symptoms of sex steroid hormone imbalances or suspected adrenal or HPA axis imbalances would benefit from saliva hormone testing as well. On a related note, dysregulation of the hypothalamic pituitary adrenal axis is associated with alterations in the serotonergic system. The neurotransmitters test assesses the serotonergic pathway. So if your patient's urinary hormone results indicate HPA axis dysregulation, consider the neurotransmitters test. If your patients have symptoms of estrogen excess or deficiency, consider the NutriPro or methylation panel, both of which reveal genetic polymorphisms which may lead to estrogen metabolism issues, such as mutations in the MTHFR or COMT gene. Also, the gut zoomer, which reveals microbiome and estrobolome influences on hormone levels. For example, your patient may be making appropriate amounts of estrogen, but if they have an overgrowth of beta-glucuronidase producing bacteria, they aren't able to remove those estrogens from the body efficiently, resulting in symptoms of estrogen excess. Also related to detoxification, the environmental toxins and heavy metal tests evaluate factors affecting elevated estrogens and reduced testosterone, as well as chronic health ailments. And finally, Vibrant America tests like the thyroid panel, which reveals how thyroid function impacts adrenal and sex steroid function, the comprehensive metabolic panel, which assesses hormone clearance, particularly through the liver, gallbladder, and renal tests, and vitamin D to help understand the role of vitamin D in fertility, androgens, and other related aspects of health. In conclusion, the urinary hormones test measures 67 analytes in 4 collections from day to night, including sex steroids, glucocorticoid hormones, hormone metabolites, melatonin, PPA, and 8-OH-DG. Patients diagnosed with or suspected of a mood disorder, neurotransmitter, or hormonal imbalance may benefit from this test as it helps identify the root cause of symptoms like hot flashes, night sweats, headaches, irritability, increased facial hair, irregular menstrual cycles, low libido, decreased muscle mass, fatigue, chronic stress, sugar cravings, weight gain, poor stamina, and thinning hair or eyebrows. By measuring your patient's urinary hormones using gold standard methodology, you can get the insight on sex steroid hormone imbalances, adrenal HPA axis imbalances, DNA damage, and BP exposure, allowing you to identify the root cause of your patient's symptoms and craft personalized protocols to get your patients feeling better fast. To learn more, visit the link in the video description, and if you can't find it, you can use the QR code or URL on this page to visit us. If you have any questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.